Hello everyone, welcome to our presentation. Today we're presenting on the chronic fatigue syndrome. My name is Asia Conrad.
And I'm Sarah Polson. All right, so what is chronic fatigue syndrome? This syndrome is a very complicated disorder, and it's characterized by extreme fatigue that can't be explained by any medical condition. The fatigue may worsen with physical or mental activity, but it doesn't improve with rest. And this condition makes it really hard for a person to perform normal daily activities. And it also has the ability to affect all the systems in the body.
So they're kind of confused about what the causes are for chronic fatigue. Some people have said that it could be a viral infection because it's they've um, tested it and have seen some differences in that. Also, it could be an immune system problem because people with chronic fatigue tend to have a different immune system than other people. And they've also tried to see if it was a hormonal imbalance. And so they're still trying to figure out what exactly is the cause of chronic fatigue. But who gets this disease? It really anyone can get it, but especially women ages 40 to 50 get chronic fatigue. And also, um, difficulty managing stress may contribute to the development of the chronic fatigue syndrome as well.
All right, so characteristics are the course of the disease varies from months to years, and full recovery is rare. So often people have periods where there's an increase in severity, and then there's also periods of remission where symptoms go away. Um, CFS is also characterized by activity peaks followed by extremely long rest periods. Sorry, guys. A person could also experience an attitude of giving up, something that has previously been earned. So basically, people who contract this syndrome, they basically have to give up their lives, kind of, because they can't do what they used to be able to do. And this leads to depression and low self esteem.
So some of the symptoms are fatigue, loss of memory or concentration, sore throat, enlarged lymph nodes in the neck, unexplained muscle pain, other types of pains and headaches, unrefreshing sleep. So you get plenty of sleep at night, but you're still tired. And then extreme exhaustion that lasts more than 24 hours after exercise.
So, diagnosis, in order, this syndrome is very complicated, so doctors have to be sure that you have it in order to be able to treat you. So the individual has to have 4 or more of the following 8 symptoms, and they have to occur for at least 6 or more months. And these symptoms are post-exertion lasting for more than 24 hours, unrefreshing sleep, significant impairment of short-term memory or concentration, muscle pain, pain in the joints without swelling, headaches, tender lymph nodes, and a sore throat.
So treatment for chronic fatigue syndrome focuses on symptom reliefs and also cognitive behavioral therapy, which is exercise programs that increase activity levels while attempting to replace negative thoughts and behaviors with positive ones. So that's a big thing with people with chronic fatigue. They get depressed and they start to have very negative thoughts that they can't do things and they're too tired. And so if you can help them have positive thoughts and get them out doing stuff, that helps a lot. There's a lot of alternative therapies that can help them as well, such as Tai Chi, yoga, acupuncture, aquatic therapy, stretching, massages, basically things that will relax them and help them focus on the positive things. Another thing that's really good for them is support groups, to be with other people that also have the same um, syndrome as them, and help them reduce their anxiety and promote well-being.
So there are a variety of medications that can be prescribed. The first is anticonvulsants. These are basically anti-seizure medications, and this drug is prescribed for pain and sleep problems. The second is antidepressants. This is prescribed to ease depression and anxiety and improve concentration. These also can help with sleep as well. And the third is narcotics. This can occasionally be prescribed for pain that is not relieved by over-the-counter drugs, but it's generally reserved for more severe cases of CFS because there's the likelihood that people can get addicted to this.
So what is the role of TRS in someone who has chronic fatigue? The main thing is support, helping them to promote a healthy lifestyle and to be that positive influence in their life to keep them going and not getting too hard on themselves. Also education, educating them to get them involved in things that they can still do with their chronic fatigue but will make them happy and feel fulfilled in life, and just promoting their health, overall health and um, strength, I guess.
And TR implications. TRs promote self-worth by helping clients focus on the present and realign their short and long-term goals. They help select experiences that are meaningful and satisfying and enhance the client's quality of life.
There's a variety of delivery settings. In severe cases, hospitalization. We're actually going to have a video link of a man who is, because of his chronic fatigue, he's getting very skinny and he's been in and out of the hospital because of that. So that can be in really extreme circumstances. There's also rehabilitation centers. Most of the time it's in-home care, and then there's inpatient settings as well. And those are our sources. So hopefully you enjoyed our presentation, and click on the video link to see the video to learn more.